talk about contemporary issues. Coronavirus is not that interesting, to be honest. It's more of a political issue than a health issue. But I thought I'd talk about, go back to basics, and talk about balanced oil, and ask a simple question: who needs it? And the answer is, in an ideal world, nobody should need it. In an ideal world, nobody should need pharmaconutrition or supplements. In an ideal world, we would be eating a healthy diet rather than being poisoned, as we are today, by the processed and ultra-processed foods that now occupy such a large part of our overall food intake. That has created a situation where the world has moved into what I like to think of as a death phase. We've increased the numbers of people with chronic degenerative disease because we're poisoning them. And we're keeping increasing numbers of elderly, very ill people alive, just with very poor quality of life, using the pharmaceutical tools that Big Pharma gives us. This is a far from ideal situation, because when you have very large numbers of people, of elderly people who already have chronic degenerative disease and have low immunity, this makes us vulnerable not just to COVID-19, because that's frankly not a serious illness, but to all other types of infection as well. In fact, it decreases herd immunity and creates a situation where the viral virulence can actually tend to increase. So COVID-19 is not the Andromeda strain. It's not disease X, but we are creating an environment which is damaging us individually and communally, and will make some future nightmare scenario more likely. But as I said, I won't focus on COVID-19 today. I'm going to talk about balanced oil and who needs it. So let me start off with the basics. Some of you, I think, are already very familiar with this, and talk about what it actually does to your cells. First of all, the omega-3, the highly unsaturated omega-3 fatty acids, DHA and EPA, it's docosahexaenoic acid and pentosahexaenoic acid, they act on ion channels which are present in the cell membranes of all cells. These are voltage gated, and what that means is they're involved in the movement of electrolytes, ions, across the cell membranes. And when you increase the amount of the omega-3 fatty acids in the phosphatidyl phospholipids that constitute the cell membranes, those cells become less excitable. Whether they're in the heart, those are the myocardial cells, and you become somewhat less vulnerable to arrhythmias, whether they're in the upper heart, atrial arrhythmias, or in the lower heart, ventricular arrhythmias. They increase the excitability of smooth muscle. For example, in your arteries and arterioles, they start to relax a little more, and so blood pressure starts to fall. And in your neurons, both in the central nervous system and in the peripheral nervous system. And that has an impact on things like depression, autism, ADD, ADHD, and I'm going to talk about the relevance of these to different age groups. So very briefly, we'll go through the life stages from conception to pregnancy to toddlers, teenagers, to adults, and to seniors, and I'll show you what the relevance of the omega-3 fatty acids and the polyphenols are to these different age groups. To start with conception, some of you who've seen my presentations know that we have real problems with falling fertility all over the world. Problems with female fertility have been increasing for a long time. And that's partly because of the fact that we're becoming heavier, we're becoming more insulin resistant, and that is intimately related to the development of a condition called polycystic ovary syndrome, or PCOS. When that happens, the hormones start to become tangled up. And so levels of estrogen and progesterone are moving in the wrong direction, but levels of testosterone may actually increase. This is not conducive to fertility, and it reduces the survivability of the egg, the oocytes, damages fertility in all kinds of ways. Inflammatory stress, poor diet, deeply implicated. And we know from a whole series of studies that have been carried out all over the world that in those people who are eating diets which are richer in the omega-3, the EPA, DHA, and also the polyphenols, we know that this is associated with increased fertility, both in females and in males. And that's important because until recently, male fertility has been showing signs of declining as well, because of the same reasons. A poor diet, inflammatory stress, falling sperm counts, falling testosterone levels. And there's lots of evidence that if you put the omega-3s and polyphenols back into the system, where they always used to be, but where the food manufacturers, the ultra-processed international food manufacturers took them away, when you put them back, you start to repair the damage. For the males, there's a rationale for this. We know that the omega-3s, specifically docosahexaenoic acid, DHA, is concentrated. It's built into the head of the sperm. And when you improve omega-3 levels, and specifically DHA, you see better sperm quality. The numbers of sperm increase, their morphology, their shape improves, there are fewer misshapen sperm, they are more motile. They're more able to reach and fertilize the egg. Whereas in women, similar data. The omega-3s have been shown to improve the quality of the oocyte and to extend the period of fertility, to put off menopause. Now that's only in preclinical trials so far, but there is some evidence that this is also the case in humans. And the polyphenols, which are broadly anti-inflammatory as well, although they have many other properties, are associated with exactly the same kinds of benefits. So what we are seeing is that both the female and the male sex cells, which are adversely affected by chronic inflammatory stress, which is what the modern diet creates, when we alleviate that stress using our blend of omega-3s and polyphenols, fertility starts to return. Then if we move on from conception through to pregnancy and lactation, there's all kinds of evidence showing that the omega-3s and the polyphenols have a role to play here too. We know that the developing fetal brain needs a lot of DHA as it grows, and it needs some EPA too. People focus on DHA, but EPA is also essential. And we know that because as the fetus is developing, these fatty acids are so important for the brain. If there isn't enough in the mother's diet, then the baby will actually steal those long-chain omega-3s from its own mother's brain. And what we see, if you do brain scans at different stages of the pregnancy, you will see the mothers who do not have a good diet, that their brain physically shrinks because the fetus growing as it grows, it is actually taking the omega-3s from the mother's brain. And this is associated both with what we call baby brain, where the mother becomes less able to focus, less able to concentrate. There may be a downgrade of memory, and it is also associated with postpartum depression. If you supplement with omega-3s, then the risk of depression and those types and baby brain just disappear, and the preterm labor and delivery, that whole constellation of factors is resolved. The baby is more likely to go to term, and the delivery is more likely to be uncomplicated. The omega-3s are built into different parts of the baby's brain, but the best clinical evidence that we have is that when there are enough of these omega-3s, then you have positive effects. The baby's visual intelligence is going to be improved. Now, this was shown originally by Professor Michael Crawford, a very great scientist and a good friend of mine. This was initially shown in preterm babies, but there is some evidence that it is also an important factor in babies who are born at term as well. So here are the ISFAL guidelines, both for pregnancy and lactation. They recommend an intake of 300 milligrams of DHA per day. They don't really focus on EPA, but it's hard to take DHA without taking EPA on board as well. I think these guidelines are a little conservative, but they're a good place to start. Time moves on. The baby is now a toddler and then a teenager. And here the omega-3s and to some extent the polyphenols have a slightly different role to play, because now it comes down to their function on neuronal excitability and firing rates. And there is really rather good data from a number of studies, again, involving some people I know and other scientists who I only know of by reputation, where increased intakes of omega-3 have been shown to improve impulse control. Now that's really important. Impulse control is all to do with the fact whether you're in a situation where you're annoyed or aggravated and you lash out, take some sort of aggressive or defensive action. That's if you have poor impulse control, or you see an opportunity to steal something and you take it because you don't think about what the long-term implications might be. because your brain cells are firing a little too quickly. Slow things down a little bit. Now you have time to reflect. Someone says something you don't like, and you think, okay, that's not important. I'm going to go on with the rest of my life. You see a purse lying on the ground, and you don't necessarily immediately pocket it and run off with it. Impulse control is very, very important for teenagers and for toddlers as well, and the omega-3s seem to have quite a well-validated role now in improving that. There has been studies in prisons and in schools where using omega-3s and various other micronutrients has been convincingly shown to reduce antisocial and aggressive and violent behavior in youth and young adult prisoners. This has been shown repeatedly, and I think is now on the verge of being included in official prison policy in Holland and possibly in some prisons in the UK. Here are the multiple clinical trials showing that the omega-3s can be used to improve behavior and scoring in the neurodevelopmental disorders, and those are ADD, ADHD, dysphasia, dyspraxia, but also autism and Asperger's. There's good evidence there. Having said that, I wouldn't use the omega-3s or balance oil on its own to help children with these conditions. There is also a great deal of evidence in many of these cases for dysbiosis, again, caused by the modern diet. And what I see in clinical terms is super additive benefits if you combine balance oil with xenobiotic to restore a healthier microbiome in the large bowel. Here are the guidelines from ISFAL. They're about as good as we get. For infants, 1 to 18 months, 32 milligrams per pound of EPA and DHA. And for children, 1.5 to 15 years, 15 milligrams per pound body weight of EPA and DHA. Not a million miles away from our recommendations. I think that they are erring a little bit on the low side. And I think that using balance oil in the way that we do, with its additional content of polyphenols, I routinely see far better results with that approach than I have ever done when in the past I was involved in using plain commercial fish oil. Time passes, we're now dealing with adults, and these are not necessarily adults with clinical disease. But what we do know, because we look at the public health statistics and we see how many people develop chronic degenerative diseases and then die of them, we know that in the public in general, chronic inflammation is now almost universal. If you're eating a diet full of ultra-processed foods, which is depleted in omega-3s and polyphenols and prebiotics, and is full of pro-inflammatory substances, you will have chronic inflammation, which will lead over time to the progressive destruction of healthy tissue, whether it's bone or joint or the linings of an artery or the nerve cells in your brain or your skin. In fact, chronic inflammation has now been implicated as such an important driver of so many of the phenomena of aging that we routinely use the term inflammaging. The bulk of the aging process, as most people experience it, is in fact chronic inflammatory stress. So we call it inflammation. And because there is so much chronic inflammation now being caused by the modern diet, we see that almost all of the chronic degenerative diseases, in fact, I think I could say all now, because for a while there was a dip in coronary artery disease because of smoking cessation, but that's now coming back. All of the chronic degenerative diseases are becoming more common. So within any particular age group, we see it increasing, the frequency increasing, but we also see latency decreasing. That is, we see increasingly larger numbers of people with these degenerative diseases emerging at younger ages. And that covers all of these diseases here: type 2 diabetes, cancer, allergy, autoimmune disease, renal, hepatic, ophthalmological, the whole gamut of the symptomology, the phenomenology of aging. Now, the point is this: you may be dealing with adults in their 30s, 40s, or 50s, or whatever, who appear to be healthy. And they will tell you, well, why should I take balance oil? Because I don't have any clinical problems. But the problem is, they do. All of these diseases, cancer, coronary artery disease, osteoarthritis, they all have long latency periods. Nature has engineered a lot of redundancy into our anatomy, into our physiology. You could lose a lot of bone, mineral bone, from the neck of the femur before it actually fractures. You may be losing mineralized bone for a period of 4 or 5 decades before the bone finally snaps. or before one of the vertebrae in your spine collapses. And it's the same with the joints, the cartilage in your hips or knees. There is enough of it to be very effective at absorbing shock and to keep you mobile. And you can lose more and more of that cartilage over a period of 30 or 40 years, a long, slow decline before you notice, I've got pain in my knee or my hips, I'm becoming stiffer. But all during that process, you actually have osteoarthritis. During the whole 40 years that you were losing bone, you had osteoporosis. You were moving towards the clinical disease. All of these conditions have long latent periods. They're like fires that burn underground for years, for decades, before they finally emerge in the open as a clinical symptom. And that's only very late in the disease that doctors will realize, because that's when you have symptoms and go to see them. They will tell you, well, you have this disease. You've had it for 10, 20, 30, or 40 years. And what that means is that most healthy adults already have these chronic degenerative diseases. They say they're healthy, they think they're healthy, they may feel healthy, but they're not. They already have chronic degenerative disease. And we see this in great detail when we take populations of so-called young, healthy adults. And what we find when we analyze them in detail, that about 20 to 30% of them will have multiple chronic degenerative diseases. They are already losing cartilage. They are moving towards clinical osteoarthritis. They are losing bone. They are losing muscle mass. They're moving towards sarcopenia and metaobesity. They are starting to lose insulin or glucose control. They're moving towards diabetes. So very few people are actually genuinely healthy. Maybe a percentage of a percentage. In the current environment, living the 21st century lifestyle of low physical activity and lots of ultra-processed foods which are pro-inflammatory and which create malnutrition, it's very hard to find any healthy adult individuals anymore. These are people who need supplementation using pharmaconutritional tools to prevent the progression of disease. And hopefully what we can do with this approach, by damping chronic inflammation, by giving the body what it needs to heal and to repair and to restore, they will not progress to the point where the symptoms emerge and they become clinically ill. So this is a population that thinks it's healthy. It actually is not. But if we give them an anti-inflammatory, nutrient-replete program, and here I'm talking about Balance Oil and Extend, and if you want to talk about the microbiome, the xenobiotic as well, now you're reconfiguring their entire metabolism to the point where their risks of moving towards clinical degenerative disease are reduced by, in my view, 90%. That is, in 90% of these people, chronic degenerative disease is unlikely to emerge. In 10%, of course, it will, because there are around 10% of the general public who have strong genetic risk factors and who will progress to clinical illness no matter what we do. But if we could reduce the burden of public health by 90%, we would transform the entire public health environment. Moving on to seniors, well, because of the way in which we live, most seniors do have active degenerative disease. They have been diagnosed with 1, 2, 3, or more chronic degenerative diseases and are seeing different specialists and are being given cocktails of different pharmaceutical products. And by the way, in America, where I am now, this is such, this approach is so vigorously promoted that death by medical intervention is now the third leading cause of death. We kill a lot of our patients. And this is partly reflected in the patterns of falling life expectancy. So much chronic inflammatory stress, so much malnutrition, that for the last 4 years, life expectancy has been falling in the United States and the last 3 years in the United Kingdom. And if we look further forward on current trends, in the next 3 decades, life expectancy is expected to fall by a further 4 and 3 years, respectively, in America and the UK. Now, America and the UK are not exceptions. They're at the head of this queue, but very close behind them, you have Australia, Germany, Finland, Poland, Ireland, and then a host of other countries. So all of the apparent progress that we've made since 1900, the so-called increase in life expectancy, and even those figures are very suspect. We are losing them. We are moving backwards because of this combination of low levels of physical activity and chronic poisoning caused by modern ultra-processed foods. So this is not only a loss of life expectancy, it's a loss of health expectancy. And we can see this when we look at populations in the blue zones who tend to stay healthier for much longer in their lives than we do. We become ill usually within the last 10% of our lives, and we spend the last 10% of our lives becoming progressively more medically, more pharmaceutically dependent. We lose our independence, we become very expensive to maintain, and this has led to spiraling social and healthcare costs, which are now running at approximately 10% of GDP in many European countries and about 20% in North America. If we could damp chronic inflammation, this would enable reduced drug use, fewer medical interventions, and if we were to combine this with xenobiotic and extend improving innate immune function and restoring metabolic balance, then we could do a great deal to reduce the impact of chronic degenerative disease on our healthcare profiles and on public health expenditure. So in this group, and in fact in all of the groups that I've listed so far, balanced soil, especially when used in the context of our health protocol, it will help to make life better. If you're interested in longer life, yep, you'll get that too. It's not what we aim at. We're trying to improve your health expectancy, but once you've achieved that, improved life expectancy comes along as a kind of side effect. I'm not interested in increased life expectancy if it means we spend another 2, 3, or 4 years in medical dependence, in chronic illness. That doesn't seem to me to be a goal worth pursuing. But if we can help people to remain healthier, functional, independent, autonomous for longer, and if as a result of that, there is an improvement in life expectancy, that seems to me to be a target that's worth aiming for. The medical profession in its current form and the pharmaceutical industry in its current form are singularly unable to achieve anything like this. We are uniquely positioned to do exactly this. Thank you. Marcus, I don't know if there's time for questions. I'm happy to take questions if people are interested.
Okay, let's go, guys, let's give Paul 3 questions. So shoot it at the chat that we have here. Thank you so much, Paul. That was very, very good overview of what we're actually doing, and I think that's really valuable. And yeah, thanks to you, we also get to explain it much better.
Well, what we're doing is we're not just selling supplements. There's a philosophy. There's an economic angle to what we're doing. There's a political implication. We are suffering because we are poisoning ourselves, and we look for antidotes. And the pharmaceutical industry sells us these products which treat some of the symptoms of the diseases which we suffer from, but do nothing to prevent their increased frequency and decreased latency. We have to address the causes of these problems, and we are really the only people who are doing this.
That is beautiful. So Miguel Volaris had a question of what is combination of ingredients in balanced soil?
Well, I mean, that's pretty basic, and you can find the answer on the Zinzino webpage if you go to the product details, but they are fundamentally EPA, DHA, and some omega-9s from olive oil and the olive oil polyphenols. This is our strategy to reproduce the health-promoting anti-inflammatory effects of oily fish, which contains polyphenols. In the marine food chain, you always find the omega-3s and the polyphenols together. You never find the omega-3s on their own. The polyphenols are nature's chaperones for the omega-3s, and they transport them through the marine ecosystem in the same way they transport them through our bodies. Once they have succeeded in excuse me, in distributing the omega-3s to the peripheral tissues, the polyphenols then take on their other role and act as ancillary anti-inflammatories. So those are the main actives. There are a host of other minor ingredients, other minor fatty acid components, but they play a subsidiary role but I don't believe that they are as significant as the main ones I've listed.
Very good. Here we have Rimbonder asking, Paul, you have spoken about cancer. What is the best combination after treatment that you would suggest to take?
Well, I think that first, let's go and start with the basics. Cancer growth, angiogenesis, the ingrowth of blood vessels into the area of the tumor, which then enables cancer growth, and metastatic spread. All of these processes profoundly involve chronic inflammation. Chronic inflammation, which at the end of the chain of events results in the release of these enzymes, the matrix metalloproteases, which then destroy the local extracellular matrix, allowing the ingrowth of new blood vessels and the release of cancer cells into the rest of the body. There is also a very important involvement of chronic inflammation in the relationship between cancer cells and local immune cells. And if there is a great deal of chronic inflammation, this interaction becomes a negative one and actually makes cancer cells more aggressive. So by switching off chronic inflammation in the body in general, and particularly around the tumor, if we can do so, interferes with these basic mechanisms of cancer growth, promotion, and spread. So my feeling would be that in anyone who has been diagnosed with cancer, one should start with using balance oil to bring the 6:3 ratio down to probably 2.5, maybe 2. Use the blood test to titrate yourself. Please excuse my coughing. I've had COVID-19. It wasn't a problem for me. I recovered very, very well. I still have a little bit of a cough. So use the balance oil to bring that ratio down. And then what I would do as well is I would use xenobiotic, because that creates an anti-inflammatory environment in the large bowel, producing butyrate. Butyrate is a very important and very useful tool to introduce into the body, which, because it also has further anti-inflammatory properties, it also has the ability to kill many cancer cells and to force cancer cells to redifferentiate. So xenobiotic has a role to play here. And then either protect and extend. So it's really basically, we're talking about the health protocol here, because both of these products contain 1316 beta-glucans, which improve the functionality of a number of the immune cells, which are involved with monitoring and defending against the cancer.
I think that was quite deep. One more question quickly. Can people still benefit even if their autoimmune disease is in advanced stages and IBD, like for example?
Mm-hmm. So you were talking about colitis or Crohn's. Okay.
Yeah.
Well, unless the colon has been completely removed, if the colon is still there, it may be damaged, but the possibility of healing and recovery is still there if the damage that is being done can be reduced. Now, when you have an autoimmune disease, what it actually means is that your immune system is attacking some part of the host tissue. Now, there's a lot of argument right now as to what exactly it is attacking, whether it is attacking the host tissue cells directly, or whether it is trying to attack a pathogen, a bacteria, or perhaps a virus that may be embedded in that host tissue. So we don't have time to go into that discussion, but it's a very, very interesting one. But let's leave it for the moment. If you can damp down the chronic inflammation to the point where there is no longer any physical damage being done to that tissue, at that point, the tissue, the target tissue, has the possibility to start to heal and regenerate. So for something like IBD, I would use balance oil initially to bring that all-important 6:3 ratio down to 2.5 or 2, to the point where you start noticing decreased symptomology. Once things have started to calm down, then you can start to introduce xenobiotic very slowly, very carefully, very gradually into the diet. You do a self-titration program, start off with a very small dose for a couple of days, and if it's tolerable, you then slightly increase the dose. Go for a couple of days, see how that goes. If you can tolerate that, gradually increase it. And the more xenobiotic you're eating, the more you're flipping the microbiome from gram negative, which is pro-inflammatory, to gram positive, which is anti-inflammatory. In this way, you're attacking this chronic inflammatory stress that is affecting the large bowel through two very different but super additive routes. What I've seen in quite a large number of cases now is that basically the whole situation can be stabilized, and you can move in some cases to what looks like a normalization of function.
Perfect. Thank you so much, Paul. This was really, really good input on all of these topics. And we appreciate you so much because we know that you're actually calling in from Florida where there's early morning. And yeah, also I wanna share with all of the people that Paul has really good books and just recently has launched his newest book, Strengthening Your Immune System, that is out at least in Amazon. I don't think it hasn't gone to Europe yet. I know some partners have got it. So ask your friends who invited you to this event on where you can get let your food be your pharmaconutrition. It's in several languages already out, and also the newest book. So thank you so much, Paul. We do appreciate you a lot.